My name is Dr Nicole Higgins. I am President of the Royal Australian College of GPs. I am also a practice owner in regional Australia in Mackay, North Queensland. I describe my journey in general practice as very accidental. I've ended up places where I never thought. As a small town country kid who used to hang around her local GPs. During high school, I went through uni in Melbourne, and my intention was always to return as a rural doctor. What ended up happening is I partnered, we travelled around Australia, and I've now been in Mackay for the last 20 years, where I've raised my family. 5 years ago, I opened my own practice as a solo GP. We now have 10 doctors working in the practice. Been very involved with education and training, so I've held roles and representative roles through the training organisations, and most recently as chair of GP Supervisors Australia. Like many GPs, I see my patients during the day. I work with my team, but I'm a mum, a taxi driver. I do the grocery shopping and the washing, and it's trying to juggle those different roles that we all have. When I first got the role as RACGP President, I was asked many times, oh, you're going to move to Melbourne or Sydney, to a capital city. I'm based regionally. I grew up rurally. That does bring its challenges, but it brings its opportunities where I can bring a different voice and perspective. Patients, in where I live, often have to travel, 10 hours to access care, or we do it in a different way over telehealth and those sorts of things. Even how I communicate with the media is completely different from what I was in the city. So it does bring a unique view, and RACGP is a national organisation, and it's now an opportunity to, put our eyes up and look Australia-wide at the profession as a whole. What's happening now is that many practices are moving to a mixed billing model, and they're doing that to keep the doors open. Practices have to not only see patients, but they are small businesses and need to pay for staff, their utilities, all the things that businesses do. And the Medicare rebate simply has not caught up with that. The cost of running a business, the Health of the Nation report has shown, is simply increasing, and the costs of Medicare have not kept pace with inflation. The costs of running a business are now increasing at about 8% per annum, whereas the Medicare rebate sits under 0.5% of CPI. It just simply hasn't caught up. We know that these lost decades of underfunding are now starting to impact how our patients are able to access care. And 40 years of having a Medicare system that simply hasn't kept up with modern general practice means that we do need to review that. But at the same token, we also need to make sure that we support our workforce and support GPs in how we deliver that care. General practice is the cost-efficient engine house of the healthcare system, and really it's not until it starts breaking down that people actually realise that there's a problem, and that's where we are at the moment. I'm really excited with the direction that we're now taking with RACGP. Our members have indicated that advocacy is a vital part of what we do, and letting government know how general practice works, improving the health system literacy, not only for our politicians, but our patients as well. The Parliamentary Friends of General Practice is a wonderful innovation that is being chaired by Senator Susan McDonald, Dr Gordon Reid and Dr Sophie Sconce, and it's allowing us to have a conversation with our politicians about the impact that funding is having on general practice, how general practice works, and how we can better support our patients to access care. So what's going to happen into the next 2 years of my presidency is that we're going to be spending a lot of time in Canberra. We will be having regular discussions, not only with the Friends of General Practice, but also with the politicians as a whole, just to ensure that they understand that the decisions that are made on behalf of people accessing primary healthcare in Australia, the impact those decisions have, and how that affects GPs and general practice. As the new president, 2 years is not a long time, but as they say, never waste a good crisis. The crisis in general practice then brings the opportunity to bring about change, to increase the funding that comes into general practice, to ensure that we bring forth our new generation, and increasing workforce is probably going to be the focus of the next 2 years. We actually, for RACGP, it is now a new era. General practice training has returned to the colleges, and that now means we have an opportunity to grow our own, to support our own, and to demonstrate the value of general practice to our medical students and increase that number, which when I went through, it was about 50%. It's now down just under 14%. So there are lots of opportunities for RACGP. My focus is going to be on advocacy, and that does mean making sure that RACGP is at the table when every discussion around primary care is being made. There's a lot of noise in the sector, but the first thing that has to happen is we need to increase that funding and we need to have general practice valued.